So this next story is actually the story of a Cameroonian woman who is now helping other women who have trouble getting pregnant. And this story is not just for women who are hoping to get pregnant or have kids. Information is powerful, my people. So this is for everybody. If you're hoping to get married someday, you want to know about this because it may be useful when you're ready to have kids. And if you're a man, you want to know about this as well for your children's sake or for your grandchildren, even if you're done having kids. You may know someone that is trying to have kids that this information may help. And I'm starting with a disclaimer. Please, I'm not saying that this is the solution for everyone that is trying to have kids. Everybody's situation is different, but this could be helpful for some people. Also, I'm not a medical doctor, so forgive me if my explanations are not so you understand. But still, make sure that you talk to your doctor if you're trying to have kids. So don't just go by whatever I talk about on this show. So, ladies and gentlemen, Marceline actually lives in Germany with her husband, and for 3 years after her wedding, Marceline was unable to have a child. She was pregnant 3 different times, and she had 3 miscarriages. So she was really desperate. She has free healthcare in Germany, and she did all kinds of tests, and they couldn't find anything until she asked the doctor to check if her tube was blocked. But that would require an operation. So in order to do that operation, they had to do a blood test. So when they did a blood test, they checked her hemoglobin. And by the way, hemoglobin is the protein in red blood cells that carries oxygen to other cells in your body. So if your hemoglobin is low, then you're anemic. And anemia can cause all kinds of things, including severe fatigue. Some people are just unnecessarily tired after doing little things. It can cause heart problems and complications in pregnancies, among other things. It makes it hard for some women to carry a baby full term. For a normal woman, your hemoglobin should be at least 13, but hers was 6.7. She was severely anemic, and she didn't even know it. Anemia affects about 2 billion people worldwide, by the way. So it's possible for a lot of people to live with anemia and not even know it. But the symptoms will be there. Some people will just always feel dizzy after small tasks. A 2008 World Health Organization analysis reported that anemia affected almost 25% of the world's population, including 42% of pregnant women. That's almost half of pregnant women, 30% of non-pregnant women, and 47% of preschool children. So it actually kills babies. Anemia can kill. But that statistics has gotten better. Now it's 29% of pregnant women that are anemic, 38% of non-pregnant women are anemic, and 43% of children are anemic. So the whole family should know about this. As for Marceline, they didn't do the surgery to know if her tube was blocked, because the moment they found out that she was acutely anemic, they said to her, this is the cause of your problem. So because when a woman is anemic, your iron level is really low, and the red blood cells are unable to carry oxygen to the body's tissue. So although it is normal to experience mild anemia during pregnancy due to increased blood volume, severe anemia may put a woman and her baby at risk of premature delivery, low birth weight, and for some women, it just prevents them from carrying a baby to full term. That's why some women would have a miscarriage. So then she started treating anemia, and they told her that it could take about 3 months to treat anemia. They gave her iron tablets, and it was giving her constipation. So an African nurse at that hospital in Germany recommended that she take liquid iron supplements. I believe she took Floradix. That's a liquid iron supplement, and within 2 weeks, she was pregnant. Today, Marceline has 2 beautiful children, a boy and a girl, and she just couldn't keep this to herself because she realized that when a woman is not getting pregnant or she's losing her pregnancy, some Africans don't start by checking the hemoglobin. That's her experience, and they don't even think about that. But apparently it's the reason why some women are not able to have kids. So today she travels the world, literally educating women about anemia. I first met her last year at Harvard when I was invited to speak, but we didn't have enough time that time. So this year, when I went back to Harvard, she also came back again from Germany as one of the speakers. So we exchanged contacts, and that was when we started talking about this. So she said to me, Adiola, it is not the witches or the wizards. It is not the devil, and it is not prayer from the pastor that people need. They should go to the hospital and check their hemoglobin. Tell people to check their red blood cell. They may be surprised. So first of all, if you're a guy planning on getting married, please go to the doctor with your fiancé. Let them check your blood cells. If you're a parent, make sure that your children, especially your daughters, know if they're anemic or not. It's very important to eat foods rich in iron, by the way, like spinach, broccoli, lentils, peas, greens, anything green. Eat a balanced diet. That's very important. But it is also good to take iron supplements, especially for women who are menstruating, because you lose a lot of blood during menstruation. So in fact, if you know that you're planning on getting pregnant in the next 6 months, you need to start taking care of your body to prepare your body for the pregnancy. You should be taking some vitamins, especially prenatal vitamins. There are so many prenatal vitamins out there. These are supplements that contain daily vitamins and minerals that you need before and during pregnancy. Folic acid, for example, is very important to take when you're planning a pregnancy. So Marceline told me that even after having her kids, that she almost lost her life due to anemia, because after she had the kids, she relaxed, and then the anemia came back, and it was giving her excruciating headache. That's how she put it. She said excruciating headache, which is one of the symptoms of anemia, by the way. So for some people, they will just have all this migraine, all this headache that they cannot explain. You may be surprised. It may be because of anemia. And it's because anemia can also prevent having enough oxygen circulating in the brain. So she went to complain about the headache. But when they checked her hemoglobin, do you know that they had to give her 6 pints of blood, like immediately? The doctor said to her that her brain could shut down at any time due to not having enough red blood cells. I was like, what? Apparently her body had adapted to being anemic, so she didn't feel like she was sick. She just knew that she had headache. So when the doctors asked her, how have you been surviving? She said, I look at the doctor, I said, do I look sick to you? So, by the way, anemia can also cause concentration problem. For some people, it's like when you're reading a sentence over and over and over 5, 6 times and you're still not getting it, it's either you're really tired or it may be due to anemia. Not in all cases, but sometimes. So, check it out. So, after having her kids, Marceline prescribed the liquid iron supplement to 8 different women that she knew who were having trouble getting pregnant. And all of them got pregnant and had kids. I was like, wow. She said one of them had twins in Germany. Today, she travels around the world educating women, and she's been to Nigeria, Cameroon, Liberia, the US. She speaks at Harvard. She's going to Kenya and South Africa soon. So she collaborates with medical doctors, and they do all kinds of medical outreaches among women. Next time, we should also talk about blood pressure, because the rate at which people are just collapsing and dying in Nigeria is alarming. Marceline has a master's in public health, and if anyone would like to invite her to speak at their church, at your mosque, at your event, please contact her via this email. Also, if you would like to support what she's doing, because do you know that she's been spending her own money to travel around the world to educate women? I was like, wait, who does that? So please contact her if you would like to support her as well. You can go on her website to see all the works that she's been doing. I'm really happy to see her turn her pain into something that she's using to help other women. So we're so proud of you. Thank you so much, sis. You guys not doing much. Guess what? I'm just keeping it real.